Today I am going to discuss about strain, the reason of strain, the type of strain, and the physiotherapy management of strain. What is strain? The injury to the muscle and the tendon is called strain. The why the strain occurs, the reason is here. Number one is sudden, unacclimatized or abrupt action or movement may tear the muscle. Number two, direct trauma can also injure the muscle and tendon. Number three, overstretching of muscle due to indirect trauma, especially in sport person. What is the type of strain? There are two types of strain. The number one is acute strain due to sudden violent force or direct trauma. Number two, chronic strain. This is due to injury existing since a long period leading to the muscle ischemia and fibrosis. What is the severity of a strain? There is a first degree of strain, second degree, fourth degree, and second degree, third degree, and fourth degree. So there is a first degree strain, mild contusion. Uh, this is due to blunt injury and is due to direct trauma. Pathology: few muscle fiber are torn, bleeding is minimal, and the fascia remain intact. So, what is the clinical feature of first degree strain? There is a localized pain and tenderness, pain and spasm when the muscle stretching. Function is not impaired to a greater extent. So, what is the management of the grade first degree strain? The management: number one, first aid is by the cryotherapy by application of ice for the period of 20 minutes. So number two is the gentle active muscle stretch may be permitted after 20 to 60 minutes. After the gentle stretch, a compression bandaging with optimal pressure. Number 5, low dose and low pressure ultrasound help in grade 1 strain. The gentle massaging of ultrasound of surrounding area may be helpful. In next one is, if pain is minimal, patient can do a light work the next day. So next one is a second degree strain. What is the cause of the second degree strain? Is here the trauma is more serious. Pathology: a greater number of muscle is torn, there is more bleeding, the fascia is still intact, hematoma is still localized. So the symptom is, the pain is more severe, tenderness is severe, severe muscle spasm, the patient is unable to move the leg. So the what is the third degree strain? What is the third degree strain? There is a large area and the greater number of muscle fiber are involved. More than one muscle group may be involved. The fascia is partially torn. Bleeding is widespread and more. There could be a both intermuscular and intramuscular bleeding. The patient experience a severe pain, loss of function. Though, what is the treatment of grade 2 and grade 3 strain? It divided into different stages. In first 24 hours, you must be apply immediately application of the ice. Number 2, compression bandages. Number 3, limb elevation. Number 4, limb immobilization in splint. Number 5, isometrics to the muscle which are immobilized. So the active exercise to the unaffected joint, pulse electromagnetic field therapy, PEMF therapy is known to be help. No active movement to the affected muscle. These all the measure you can done before in first 24 hours. After the 24 hours, during the 24 hours to 48 hours, the pressure bandages is removed and active muscle exercise are begun. So the stretching within the limit of pain is commenced. The thermotherapy, the ultrasound, shortwave diathermy, and the TENS help to relieve pain. The slow rhythmic massaging help relieve the muscle spasm. So non-weight bearing on crutches is slowly start. Rest of the measure as same. Now between 48 to 72 hours. Apart from all the measure mentioned so far, the additional measure during the phase this phase include more vigorous active exercise are encouraged, a deep transfer friction massage is added, and the partial weight bearing can be permitted. So after that 72 hours, all the above measure are pursue in a more vigorous manner. Pressure bandage is totally removed. Progressive resisted exercise using the floor techniques by taking out 10 to 12 repetition maximum is prescribed. A full weight bearing should be permitted in the injury of the lower limb. After a full movement is regained, the patient is allowed to walk and jog. The full functional activity should be regained by the 4 to 6 week. If the patient have fourth degree strain, the causes of fourth degree strain is due to severe trauma. Pathology is complete tear of the muscle, and the fascia is torn, and the considerable bleeding within the intermuscular and muscular and diffuse. The grass swelling is present. Clinical feature is of the fourth grade is the excruciating heart pain, excruciating pain, excruciating pain. Severe tenderness is present. A snapping shown may be heard by the patient. Palpable gap between the muscle may be felt. The severe loss of function, active movement produced by the antagonistic are absent. The active muscle contraction is absent. Joint function is not lost, and the muscle spasm is very severe. So that what is the treatment? Surgery is advised. This involves the opening the rupture site and evacuating the hematoma and suturing the facial sheath. A direct muscle rupture is repair is avoided. So next one is compression bandage is applied and the limb is immobilized for 2 to 3 weeks. Active exercise in to the unaffected joint. Slow rhythmic isometric exercises to the affected muscle and non-weight bearing after 48 hours. The use of low frequency current Faradism to obtain a passive contraction is very useful. Deep heating modality like ultrasound ECT can be helpful. The rest of the measure is same as grade 2 and 3. The other measure you can proceed like grade which are done in grade 2 or grade 3. Same.